According to World Report on June 26, 2018, the non-medical use of prescription drugs is becoming a major threat to public health. Though growing uncertainties, harsh economic conditions, environmental hazards, unemployment, stress, depression, and anxiety increasingly encourage unhealthy choices for drug misuse, dependence and addiction. In today's world, prescription drugs are highly used and misused, especially opioid painkillers. The role of legal drugs for the treatment of diseases and discomforts can't be understated. They are absolutely safe when taken according to doctor's prescription. Nonetheless, due to their powerful effects and addictive nature, some people quickly develop dependence and addiction. Prescription drugs misuse creep in when self-assumption to feel good or get high is desired. The initial pleasure gotten by using these drugs cause many to crave for more, which comes with physical and life-threatening health implications. Let me outline prescription drugs that are often used and misused. First are opioid painkillers, also known as narcotics. World Drug Report by the United Nations Office on Drug and Crime, UNODC, in 2018, revealed that drug use disorder involving opioid caused 76% of deaths. Most people who abuse opioid painkillers started by taking a prescribed dose. But, as the nature of addictive drugs, their body will rapidly develop tolerance and dependence on the drugs. Check my previous post on tolerance to learn more. At tolerance, they need a higher dose, against the doctor's prescribed amount to get some pain relief. This fuels addiction. Here are a list of some opioid painkillers. Number 1. Vicodin and Oxycontin. These are popular pain relievers. Abusers usually grind and sniff them to get high. Research has shown that people who use Vicodin and Oxycontin always get addicted to heroin, because their effects are similar to that of heroin and they are cheaper. There is an alarming record of heroin overdose. Number 2, Fentanyl. This is a strong painkiller with addictive substances. It is often prescribed for chronic pain, as in severe injury, surgery, or cancer. Once a person gets addicted to fentanyl, it is difficult to get relief from other painkillers, because reaching tolerance level is always fast with fentanyl. Pharmaceutical fentanyl is used for managing acute pain, while illegal fentanyl can be unlawfully manufactured by drug lords for illicit use. Medically, fentanyl is administered through injecting the drug into the vein. On the contrary, people abusing the drug usually put it under the tongue, which they suck gradually. Abusers also smoke or inject the squashed liquid. Many drug manufacturers encourage abusers by covering the drug with a sweet substance which appear like a lollipop. After they suck out the sweet, they extract the drugs. Research has revealed that the number of deaths in the United States from synthetic fentanyl rose more than 10 times in 5 years, showing that the number of deaths in the US involving synthetic opioids increased from approximately 3,000 in 2013 to more than 30,000 in 2018, causing twice as many deaths as heroin. It is 50 to 100 times stronger than heroin and morphine. Number 3, morphine. This is used to decrease the feeling of pain. It acts directly on the central nervous system and quickly relieves pain. Number 4, methadone. This is an analgesic drug that is similar to morphine in its effects, but less sedative and often used as a substitute drug in the treatment of morphine and heroin addiction. Methadone has many adverse effects, and its overdose may result in coma or death. Number 5, codeine. Codeine is an opiate used to treat mild and moderate pains. Opioid painkillers are generally safe when prescribed by a doctor to relieve pains for a short time, but, when taken in a larger quantity than is prescribed, or without a doctor's prescription, it can produce a euphoric high. Many states are experiencing an epidemic of opioid addiction and overdoses. Dextromethorphan, DXM. This is a non-opioid drug that helps to stop cough. Large doses can get one high and cause hallucinations. It is popular among teens. Another non-opioid drug commonly used is Pseudoephedrine. This is a decongestant. It helps clear off stuffy nose, and is added as an ingredient in illegal methamphetamine, meth. Cold and cough medicines contain pseudoephedrine substance, hence cough syrups are behind-the-counter drugs. Other commonly abused prescription drugs include antidepressants, mood stabilizers, stimulants, and anti-anxiety medication. Legal and prescription medicines are the most commonly abused drugs, because they all have strong effects on the body. These medicines can be dangerous if used in the wrong way. Sedative drugs like diazepam and Xanax help with anxiety, sleeping, and some seizures. If one continues to use them more than the recommended period by a physician, it can result in drug dependence and addiction. Non-medical use of prescription is a global problem. Say no to drug misuse. Avoid falling in the pit of drug addiction. For more insight, grab a copy of this book, Exposing the Shameful Face of Drug Addiction. It's just one click away from Amazon, BookBaby Bookshop, Barnes & Noble, Book A Million. You can get the book in over 60 online retailers across 170 countries. Don't forget to share and subscribe.